Welcome back to The Wellness Effect. Remember to subscribe to our channel and hit that notification button so you don't miss out on any of our discussions with our experts. Dr. Theonette Joubert is a qualified, experienced chiropractor, joins me today to discuss chiropractic care, chiropractic practices, and more. Welcome, Dr. Joubert.
Thank you so much.
Can you explain to us the benefits of maintaining regular chiropractic visits to ensure spinal health?
So when we look at having a regular chiropractic visit, we're looking at really getting to the point of optimal spinal health. So if you think that the nervous system controls everything in your body, it would make sense, that we would want to keep it running as smoothly as we can. When we look at maintaining regular visits, the big thing that people come to you for is pain relief. So that's the first thing that we really help our patients to get so much alleviation from, is getting them down on the pain scale. Once we've got the pain down, then we really start looking at getting optimal spinal health and getting optimal function. And once we've got that sorted, oftentimes a lot of secondary health problems go away along with it.
What sort of secondary health problems could you?
So these can be quite interesting. We've had quite a few interesting cases where we look at constipation. Oftentimes people are constipated because the mid-back levels are out. We've had funny things such as snoring that goes away because, again, everything, muscles around the throat are less sore. When we look at our younger patients, our pediatric side, we've got babies sleeping better because we've got less discomfort. The moment that the spinal or the nervous system is less irritated, less alert, people tend to sleep better.
So what common misconceptions do people have about chiropractic care and its role in preventative health?
Okay. So oftentimes people come to chiropractic visits only when there is pain. And that's a very big misconception. The main key role of chiropractic where we want to get is to have it as a preventative measure. So yes, we do 100% treat chiropractic pain. And oftentimes people have the concept that we only treat joint pain, which is also not the truth. Anything in your body that goes red light, something's sore. If it's got a joint, it's got a muscle, it's got any sort of soft tissue, we fix that. If it's a shoulder, if it's an elbow, back, neck, anything that's sore, we really do fix. The second misconception that we often get is that chiropractic treatment is dangerous in some way, or that you've got a high risk of getting some sort of injury. And that really isn't true. Chiropractors are trained very, very hard to look after their patients and maintaining their optimal health. So we are very, very well trained in making sure that we do not endanger our patient's life in any way, whether through the adjustment or the muscle work that we do before or after our adjustments.
So how do you assess a patient's risk for spinal issues, and what factors do you consider?
So in any chiropractic session, especially your first session, we really do a thorough history taking. And from your history taking, you can gather so much information on where your patient has been and where they're going and how they would recover. So we really go into detail there. So that would contain, have you had prior injuries, operations, any of those sort of big factors like car accidents? That's a big one. Oftentimes 10 years later, we see patients with whiplash only presenting with symptoms now. Then we look at any chronic illnesses. Is there blood pressure, cholesterol, diabetes, thyroid issues, any underlying medical condition that might contribute to their health being affected, or we've got the big things like rheumatoid arthritis or any of the big ones. We still work with those patients. It just determines what our expectation is, that we also communicate to the patient on what the road forward would look. We then also have a look at a big one, is your occupation. Is this patient someone that's sitting a lot of time, standing a lot of the time? Are they very physically active? So the occupation really makes a big influence. If we look at today's culture, that we've got most of your patients sit at a laptop or a computer for multiple hours in a day. And that's got big repercussions for spinal health.
And how does stress affect spinal health?
So that's a big one. If we look at our previous question, I always use this example of my husband. If I watched him working from home, the beginning of the day, shoulders would be down and it starts. And as the day builds, the shoulders come up, they come up, and they come up. Again, if you spend a few hours a day with your shoulders and muscles so tight because of stress, you are going to have massive spinal outcome. All those muscles are connected to the vertebra, which are again connected to the spinal nerves. If we've got those muscles tense all day, we do not have proper oxygenation going to the blood, we've got muscles in continuous stress and spasm, which causes chronic muscle spasm. Chronic muscle spasm results in multiple pain, whether it is headaches, whether it is burning sensation in the muscles, it can be lower back pain, it can be gluteal pain, sciatica that everyone often experiences. We've got massive spinal outfall because people are stressed. If we look at stress as a whole, we increase the inflammation. We are in that fight or flight stage when we are stressed. And that is a massive, or our inflammation just goes through the roof. Inflammation makes connective tissue sticky. Everything, muscles stick together. Everything just becomes a crazy, dangerous or unideal circumstances for your body to function optimally.
So how can individuals incorporate into their daily routine preventative chiropractic practices?
So we've got this saying where we say motion is lotion. So that's the big thing. Whether you are sitting at a desk or whether you are standing all the time, you've got to have different movement. So if you do have a desk job, you make sure that you alternate standing and sitting between that. Make sure that you do have a quick run up the stairs and down the stairs. So that's a big one. If you are continuously standing, try and do make breaks for a short period of sitting or stretching out those muscles in different positions. Doing exercise, this can now be your high intensity, it can be your yoga, it can be your Pilates. Your exercise regime very much differs on obviously personal choice and then again your physical ability. Healthy eating, that's a big one. Again, we make sure that our inflammation is as low as possible. Having proper sleep, having good ergonomics in your sleep situation, and again at your desk side, making sure that you do have the right ergonomic setup. You're sitting correctly, your laptop is positioned correctly. And then again, a big thing is having a regular chiropractic visit, making sure that we do keep you in that perfectly aligned space or keeping you in there as long as possible to make sure that you are performing and working optimally.
And how many times a year should you ideally visit a chiropractic?
So this is also a very patient unique recipe that you've got to determine. I'll always tell my patients, if you've got the budget for it, once a month is fantastic. If you are a very active person, you've got a physical job that really demands that of you, you've got to have that close interval. You cannot take this long because the moment that you do have some sort of misalignment, if you leave that for 6 months, that's becoming a chronic position for that joint. And then it becomes a difficult story getting you out of it. And then we see that we need a second or a third follow-up to get this aligned. So we tailor it to each patient's needs, budgets, and what they need. On the initial consultation, if someone walks in, you often need a bit more at second or a third session just to get everything to a more neutral position. And then we go into a maintenance depending on the needs.
So for someone who's never been to a chiropractic practice, what are they going to experience? Should they be afraid, with all these TikTok videos? What can you say about that?
So oftentimes when a patient comes in for the first time, there's a certain level of anxiety around the appointment. And I think the first thing that you've got to do as a practitioner is just settle them down, and working them through or walking them through the process helps so much with that. So generally what you can experience on your first chiropractic visit is you come in, you have a sit down, and then we just have a nice conversation about your health. Where have you been? What have you done? What have you broken? What have you injured? What have they removed? And then we chat about where your pain is. When did it start? How bad is it on a scale of 0 or 1 to 10? We do an assessment just on your history. If there are any risk factors that the chiropractor is concerned about neurologically wise, you might have a neurological exam, which would be your reflexes, testing the strength of the different muscles involved. If we're really not concerned about the neurological side as much, we'd focus more on the muscle side. So once you're done with your history taking, you will then go to the chiropractic bed, lay down either on your stomach or back. Then the chiropractor will start assessing the muscles. Are there any trigger points, which is the word we use for a normal muscle spasm? Where are the trigger points? How hard are they? Are they tender to the touch? And then we assess the joints. So you start at the neck or the bottom and you look and you make notes on which one of the joints are restricted, in which position, are they right, are they left? You add then that to your notes. Then depending on the chiropractor's preference or the patient's preference, you will start with, I usually start with soft tissue therapy first. Some chiropractors like to adjust first. Generally in my practice, they will be massaging, they will be dry needling, which is a needle technique that we use on the muscle spasms. They will be hands-on massage, stretching, dynamic stretching, depending on which muscles we're working with. And usually I then end off my sessions with the chiropractic adjustment. If I find joints are out in all 3 sections of the back, I'll make sure that I adjust every single section. If we are dealing with a knee or an elbow and an ankle, we always move down to those joints as well. Your chiropractor oftentimes will send you home with a bit of homework, whether this is changing your posture a bit or adding stretches. These are usually simple stretches to make sure that we enhance your healing time or shorten your healing time and enhance your time being pain-free.
So thank you so much, Doc, for such an insightful conversation. I think a lot of us are going to be signing up for a chiropractic session very soon.
Thank you so much for having me. It was so much fun.
And thank you to our viewers for joining us. Don't forget to subscribe. Till next time, goodbye. BankMed, the medical scheme of choice for the financial services industry. The Wellness Effect is proudly brought to you by BankMed, yours in good health.